significant numbers of black and ethnic minority staff are being subjected to racial discrimination by their colleagues. It says that in 3/4 of all trusts in England, they were more likely to report being harassed, bullied or abused compared to white members of staff. The Health Service says it's investing £2 million to deal with the problem. With me now is Joan Sadler, Chair of the NHS Equality and Diversity Council and Associate Director at the NHS Confederation. Thank you very much for taking the time to talk to us. And 75% of acute trusts had this higher percentage of black and ethnic minority staff saying that they had been harassed or bullied or discriminated against in comparison to white staff. I mean, that figure is quite incredible. Is this the first time that the extent of it has been realised?
I think that's a good way to put it. The extent has been realised through us using information that has already been there. It's been there for a few years. But what we've done is we've taken very broadly the stats and put them together so that trusts can now see this isn't a story, this isn't fluff, this is real. And so the evidence base is real.
So you're saying the evidence has actually been there for a few years, but only now that it's been collated in this way, do you think that something is going to be done about it?
Yes, because to be fair to, I work for the NHS Confederation, our members would say they're really squeezed. We will do what is at the top of the agenda. Actually, this is at the top of the agenda, and we need to skill up our members and give them the space to do what the top of the shop or the NHS leadership requires. And I should say I'm co-chair of the Equality and Diversity Council with the NHS Chief Executive, who is Simon Stevens.
And this is staff being harassed, bullied by other staff?
Yes.
And we all go into, various public buildings. You'll see posters warning the public not to abuse, whether it's hospital workers or train staff or whatever it might be. But it's astonishing to hear that these are colleagues abusing other colleagues. What do you propose to do about this?
So we have an Equality and Diversity Council. We are saying this is a first priority among others, but the priority is to expose the data and then think about what are the mechanisms, what are the levers that will enable us to deliver on core NHS business, such as improving care for people receiving our services. And we think this lever is one of them. We then need to be as skilled in looking at the data.
So in other words, let me just interpret that. You're saying, therefore, a happier workforce, a workforce that doesn't feel abused or harassed, is going to be delivering better care.
It is. And there are white members of staff who are harassed also. But what we're saying is there's quite a divide between those members of staff who are BME and who are white.
What do you think culturally is going on that has created this situation?
Great question. So it's not an NHS issue as such. If you think about the Macpherson report, talked about institutional racism, the public sector itself has an issue of how we deal with discrimination and racism, because they are different, but they are combined. There's something about, if you think about the narrative at the moment, Brexit is not about immigration, or shouldn't just be about immigration. So this narrative of BME, negative, let's think about difference, but think about it in a negative way, feeds this idea of who is harassed and who is intimidated within a service. And I think what we need to be doing is thinking about difference as an asset base, leaving our services to get on with what they do best, which is to listen to staff and patients to fix things so that they're better for patients, not actually pick out people who we think might not be able to deliver in terms of the usual leaders who deliver.
Okay, Joan, very interesting to talk